Thank you. Mr. President, Honorable Director General and Regional Director, Excellencies, Honorable Ministers, distinguished delegates, ambassadors, ladies and gentlemen. First of all, I want to express my gratitude for the opportunity to speak here at the 68th session of the WHO Regional Committee for Europe and express confidence about the usefulness of the discussions going on here. As you know, Armenia recently has gone through the fundamental political changes after the transition of power has taken place in our country. A new prime minister was elected by the parliament, forming a new government. The new government is aimed to build a prosperous and democratic society, and we do understand that in this context it is crucial that health is in the top priorities. Current priorities of the Ministry of Health include prioritizing the health and increasing allocations for health. We do know that despite annual increases in our health budget, it is still low by international comparisons as a share of government spending, a share of GDP, and in absolute per capita terms. Now we are very keen to increase the health budget allocations for 2019 and go further with an introduction of the health insurance system that will help us to achieve the universal health coverage in Armenia. The next priority is the strengthening of primary healthcare system in Armenia. The PHC strategy has been in place for over 10 years. It envisages that PHC should be eventually provided predominantly by family doctors and nurses, while neurospecialists in polyclinics should either be trained as family doctors or merge with their functions with hospital outpatient services. Implementation of the strategy to date has been quite successful at improving clinical skills and doctor distribution in rural areas. The PHC service delivery model definition and new strategy is also included in the list of our priorities. Preventing and controlling NCDs and promoting healthy lifestyle are top priorities in the current health agenda of the government of Armenia. We now have about 62% of the targeted population involved in screening programs that tackle diabetes, hypertension, and cervical cancer. We already have observed tangible results, and we hope to see a significant decrease in mortality rate associated with these three NCDs in upcoming years, and therefore we are committed to expand these screening programs. Unfortunately, we have a high prevalence of smokers in Armenia. About 52% of adult males are daily smokers. In 2004, Armenia ratified the WHO Framework Convention on Tobacco Control, which created a solid foundation for designing the law on limiting realization, consumption, and use of tobacco products later the year. I'm glad to share that our team is now working on new tobacco law, which imposes a longer list of restrictions on realization, consumption, and use of tobacco products in Armenia. We are determined to win this battle and to protect our citizens from the second-hand smoke exposure. Healthcare reforms aimed at public health strengthening, PHC restructuring, improved quality of care, and other areas will create a basis for further reforms to achieve the goals of universal health coverage. Currently, Armenia has favorable conditions for further effective health system reforms due to the strong political commitment to these reforms. Thank you.
Thank you. According to the list of speakers, the delegate of Norway.